Cartilage injuries that involve both cartilage and the underlying bone are commonly treated using osteochondral allograft transplantation. While effective, this approach is limited by the shortage of available donor grafts and their short shelf life, which can make surgical scheduling and meeting patient demand challenging. To address these limitations, researchers from Cornell University, along with scientists from Epibone, evaluated the safety and efficacy of a tissue-engineered osteochondral allograft, or TEOCA, compared with a standard osteochondral allograft. Using a controlled laboratory design, researchers created bilateral critical-size osteochondral defects in the femoral medial trochlear ridge of skeletally mature horses. Each animal received a TEOCA in one defect and a donor allograft in the contralateral defect as a positive control. Healing was assessed over 14 months through quantitative lameness evaluation, synovial fluid analysis, radiography, arthroscopy and postmortem imaging, biomechanical testing, and histologic analysis. The results were promising. The TEOCA demonstrated superior cartilage-to-cartilage integration on histology and lower T1 MRI values, indicating intact regeneration of the cartilage matrix. Over time, the engineered graft matured in vivo, with biomechanical properties improving to levels comparable to those of the donor allograft. No significant differences were observed between groups in radiographic, cartilage, or morphologic MRI scores at the end of the study, and no off-target effects were detected. Taken together, these findings show that a TEOCA can perform comparably to donor grafts in safety and effectiveness. This work highlights the potential of engineered grafts as a reliable alternative for repairing osteochondral defects.